Good afternoon. Well, there's been a significant increase, it seems, in the number of COVID-19 infections around the country, despite the fact we do not have a new variant. There's certain authorities in this say that this wave has been driven by a subvariant of the Omicron variant, but there's still, from what we can see, no increase in the number of excess deaths or in the number of people who need to be admitted to hospital or ICU with the disease, with COVID-19. Professor Bruce Mellado is a member of the Coronavirus Command Council in Gauteng. I should say the Gauteng Coronavirus Command Council. He joins us now. Professor Mellado, I do appreciate the time. Good afternoon to you, and thank you. What does the data tell us about what's happening in Gauteng at the moment?
Stephen, thanks for having me again. So let me summarize what we think is going on in the province based on the data we have accumulated for the past 3 weeks. So about 3 weeks ago, we saw a relatively sharp increase in the number of positives. Since then, what we have seen is a surge that seems to be growing at a pace that is significantly lower than the fourth wave. We see that according to the modeling, and the modeling we had before the surge took off, that what we see is sort of consistent with optimistic scenarios, so it's not very impactful. We are seeing that as of last week, the growth in the number of cases and other indicators seem to have slowed down. So according to modeling, we should be peaking as we speak, although the data from today and tomorrow will be very important to confirm this hypothesis. What we also see is that the number of hospitalizations, severe hospitalizations in hospital deaths is very moderate altogether. We monitor very closely the different types of hospitalizations and the numbers essentially on a daily basis. And already 3 weeks into the surge, what we see is that the number of hospitalizations and the growth is very, very mild. And for the moment, the hospital system, both private and public, seem to be coping fairly well. This seems to indicate that, yes, we do have active community transmission, but it looks like we are completely dominated by reinfections. People are getting reinfected, they had the virus before or have been inoculated, and then basically this leads to a slowdown of the community transmission once, and second, the fact that we don't see a lot of severe cases in hospitals.
Okay, so you say we're not just in a fifth wave, we're actually near the peak of it, perhaps. It doesn't feel like it, I must say, Professor.
Well, okay. The Department of Health has some guidance as to how to define the wave. It's not clear that what we see it really is or qualifies as a wave. The numbers are not big enough. We, in our committee, and when we interact with the media and interact with policymakers, we call what we see a surge. Now, a surge can be modeled as a wave, and it basically increases, reaches a peak, and goes down as well as a wave does. So basically, given what we see and the numbers of what we see and the different indicators, it's not clear that what we see is a wave. It's certainly a surge, and we study the surge, and we also give predictions as to what the surge is going to look like in weeks from now.
So at the moment, I mean, when we've spoken about previous waves, you and I, they've always come, I mean, it's always been a slightly scary moment to predict what would happen. We've seen, particularly in the second and third waves, very high numbers of hospitalizations. It's a very different situation now. Is that just because we've all been exposed to the virus in some way, because we've been vaccinated, or because we've got some level of immunity just through exposure? Is it that simple? I mean, I realize it's not simple, but is that the reason?
It's not a simple question because you have different factors at the same time. Now, if you read the literature and a lot of the studies that are coming up from different countries, the strongest hypothesis to explain what's going on in South Africa is that we've had already a lot of people, or at least in Gauteng, having had the virus in the past, having had Omicron in the past, having been inoculated, or a combination of these effects together. So what seems evident, if you look carefully at the numbers and how the numbers evolve, and the fact that we expect the corresponding dominant subvariants that our genomics team tell us is dominant, are dominant currently, and the fact that we don't see such a strong rise in the number of cases, we don't see such a strong acceleration as we saw in the fourth wave. The fact that the peak of the fourth wave in terms of bed occupancy was about 4,000, that was actually a fairly large number. We're now roughly hovering around 1,200 in the province. This probably tells you that the fact that the most of the population has been infected with the virus, and also the role of vaccination, which also is very important. Both effects tend to basically lead to the effects that we see right now.
In the past, we'd always been under the sort of presumption, or epidemiologists have been under the presumption that a new wave would be driven by a new variant, and that without a new variant we wouldn't get a new wave. But this is, I mean, something very different seems to be happening now. This is a sort of sub-variant that's driving a new wave.
Well, waves are driven by a number of factors, so not necessarily the emergence of a new variant or subvariants. Okay, this is a combination of factors that lead to a wave. So it's not necessarily the fact that a new wave will emerge because of a new variant. We have seen waves emerge in the past when you had a fairly stable composition of the virus. We're seeing now an evolution of subvariants within Omicron, yet we see a wave. It's really a combination of factors, but I wouldn't say that we need to, the fact that a new wave emerges as a result of the fact that we have a new variant. That's not necessarily the case. For a wave to emerge, basically what happens is that you have community transmission, you have a virus that is continuously moving around people, transmitting with people, and then you have certain conditions for that situation of equilibrium to be broken, and then you basically have a strong increase in the number of cases. That can happen without a new variant. That can happen with a stable variant. It can happen also because a new variant that is more transmissible emerges. So there's certainly all these things and all these factors need to be blended into the model.
So, I mean, in a way, this is a story about a new wave. Some people, I think, are going to be quite reassured from what you say, that we don't have this big increase in hospital cases. Are we right to be reassured, or do we still need to be on our guard to quite a big extent?
Absolutely. I mean, the message that we sent out to the province and all the stakeholders is that we need to adhere to the non-pharmaceutical interventions in place. In particular, it's very well understood and it's very well studied that there is a high probability of transmission indoors, so when we are in public transport and we don't open doors or windows. So the fact that when we are indoors, we absolutely have to adhere to social distancing measures as defined by rules and regulations, wear masks, sanitize, keep distance. That's because most of the transmission is happening indoors. And that when we have a surge like the one we have right now, when we have fairly active community transmission, it's very important that we adhere to non-pharmaceutical interventions as described before, because we are in the middle of a highly transmissible virus. I mean, the virus transmits fairly quickly. So in order to slow it down and help the healthcare system, help ourselves, et cetera, it's very important to continue adhering to social distancing measures, in particular indoors.
Professor Bruce Mellado, I really do appreciate the time as always. Thank you very much indeed. The mathematical modeler, Professor Mellado, is a member of the Gauteng Coronavirus Command Council. He makes predictions, as you've seen in the past, around the movement of COVID-19 in Gauteng.